Hi, this is Dr. Rachel Langley with Pine Ridge Family Medicine here in Colorado Springs. We are a direct primary care practice, and if you don't know what that means, maybe check out my partner Dr. Tony Vecchiarelli's video right there to explain a little bit about what DPC is, what it's all about. A brief summary is that you pay a monthly fee so that you can be a part of our practice and see us doctors as much or as little as you'd like. We can generally get you lower prices because you're paying cash for medications and labs and imaging and sometimes even referrals depending on the referral and the relationships that we have in town. So that's what direct primary care is it goes outside of the insurance system and it doesn't count as health insurance to kind of cut out the middleman and allow doctors to provide you with better care because we don't have to do all the paperwork for insurance and spend all our time doing coding that meets their requirements. And instead we can focus on you, the patients, and have longer appointment times and get to know you. So here in Colorado Springs, we have a huge military population. It's wonderful. And being prior active duty myself, as well as currently a reservist, I know a little bit about Tricare. I'm by no means an expert. Tricare and health insurance in general are generally very confusing to me. But I've done a little bit of looking up into the current rates of Tricare options and insurance right now. And I wanted to talk with you a little bit about why, if you have Tricare, why would you even consider doing direct primary care? So basically in TRICARE, you've got kind of three categories as far as I see it. You've got active duty, which is an awesome system. I mean, free healthcare. And that's all you have to say, free healthcare. When I got out, I was looking at $1,000 a month for me and my family to have healthcare. And that was with a high deductible, $6,000. So I'd have to pay $1,000 a month plus $6,000 for any major medical incidents, and then they'd start covering my stuff. I mean, they cover the basics in the meantime, but man, I can't afford that even as a doctor. Then you have retired TRICARE or TRICARE for life, and that goes up till age 65, and then at age 65, Medicare starts kicking in. But even before age 65, it's a great deal. You have to pay, from what I was reading, about $280 a year for an individual to have health insurance. Whew, that's a great price. Or for a family, it's like $560. Wow. I mean, we at Pine Ridge Family Medicine have the lowest monthly fees around. There's quite a few direct primary cares in the Springs. They're all fantastic from what I know of them. But we have the lowest rates, just saying. But even with our lower rates, it costs about $940 for an individual comparatively, or $1,260 for an adult and a child. Whew, you're right. It just doesn't compare with how good of a deal it is to have TRICARE for life. TRICARE is awesome. And then for the reserves and guard, oh my goodness, it's about $220 a month for health insurance for reservists and guard. Oh my goodness, great deals. I love TRICARE. So why with such great prices would you even consider? Why are you doing this video, Dr. Langley? Let me tell you. Well, first of all, let me get out there that if you're trying to go to direct primary care or a civilian doctor to avoid the military finding out about certain diagnoses that you worry might get you kicked out of the military, bad idea. I've been in the military, I've been a flight doctor, I've done MEBs, medical evaluation boards, that sometimes got people kicked out, sometimes limited where they could PCS to. I know it's a hard road, but you really do want the military to know about any health diagnoses you have. It's such a physically demanding job, I promise, that we really are looking out for the best for you, the best for your family, and also the best for your battle buddy. We don't want you to deploy with something that's going to keep you from keeping your unit safe. So with that little warning, why would you consider doing DPC? So certainly not to avoid having diagnoses put in your medical record with the military. Thank you. But mostly because it's easier to get in with us. I mean, every area is a little bit different. Every clinic's a little bit different. And with different regulations coming down and the switch to DHA, it's going to continue to change as to how easy it is for you to get in with your doctor. Active duty is generally easier, but dependents, spouses, and retirees can have a long wait to get in with their doctor. And especially if you have something like a UTI that really doesn't require that much care, that much of a workup, just a quick visit to get antibiotics, Man, that can be a long time to wait to get in with them. Sure, you could go to an urgent care, but then you're seeing a different doctor every time. It doesn't get recorded in your record properly. If you have recurrent UTIs caused by the same bacteria, there's no one to do the culture to see what else we should be doing to avoid these. So it's better care with a primary care manager that you see every time. And not only that, you can email with me and Dr. V. You can text us after hours. You can call the front desk whenever we're open and get information right from us if we're not with a patient. We're really easy to get in with and easy to communicate with, and that's so lovely. I also love that you have better continuity with us. I mean, we're here for the long haul. I'm not moving anytime soon. We're really settling down here. And if you're settling down here too, if you're a retiree, then you want to have a doctor that knows you, that can have a conversation about your likes and interests and has seen you more than once. And with active duty clinics, it's so often being PCS. As soon as you get to know your doctor, you know that they're going to have to PCS. I've been through that many times myself. And it's hard for the doctors, it's hard for the patients, and you don't get the care that you really deserve. You aren't going to miss out on all the benefits of Tricare if you decide to have a DPC doc as your primary care manager, your PCM. You can often get paper prescriptions written out for any medications, labs, imaging, even sometimes referrals depending on the clinic, that you can go to the Tricare clinic then and have filled and completed and then have the results come back to your direct primary care doctor. So it's a pretty cool system that you can use a lot of the benefits of the free labs, free medications, but also be able to have the continuity of a direct primary care doctor, a better PCM that you're able to see more often. Even your doctor might actually appreciate you going to a direct primary care doctor, because when we send your records on base in case of you PCSing or just to update the doctors there with what's going on with you, our notes are going to be a lot more succinct. I have seen their medical records from hospitals and ERs in the area, and they're pages and pages and pages of sometimes just ridiculousness, things that I don't need to know that aren't helpful. So you should compare that with our notes here at Pine Ridge Family Medicine, because there's so much more to the point with the important information that you need, not all the extra vitals from every hourly check that you had when you were in the hospital for 4 days. Oh my goodness, why are those even there? So even your doctors and the record keepers will appreciate you having a PCM that's a direct primary care doctor. So in summary, I think that your time as a military member or retired military member or guard or reservist, all that good stuff, is worth more than having to wait as long as weeks to months for a visit with your doctor. So that's why I think you should come here to Pine Ridge Family Medicine, or if you're not in Colorado Springs, look up some good DPC, direct primary care practices in your area and go to them for your day-to-day care, and use Tricare as a backup in case you need a hospitalization, in case you have an accident, something like that. It's wonderful to have such an inexpensive but comprehensive and excellent care option available to you. But for your day-to-day stuff, come see us. While you're at it, please subscribe to our channel here at Pine Ridge Family Medicine to hear more about health information. And here's a video right here that might be helpful for you. Hope you're having a great day. Thanks for watching.